Fantastic. So thank you everyone for attending this session. My name is Michelle Dubinsky, as Natasha mentioned, and I am a PhD candidate in the Institute of Medical Sciences. So thank you again for having us through the GLSE. Here's our leadership team. So we have Dr. Mingyao Liu, who's the director of the Institute of Medical Sciences, and we have Dr. Vasu Venkatswaran and Dr. Lucy Osborne, and these are our graduate coordinators. So if you are involved with the IMS, you will know these faces and names very, very well. In addition to that, I would like to point out our staff and administrators who are fantastic. And the one person I would really like to mention who is on this call today is our admissions officer, Miss Hazel Pollard. And she is fantastic and will be answering your questions today. So if you remember anybody from this talk, it's really Miss Pollard. She is the most important person here today for the IMS. So the IMS is within the Temerty Faculty of Medicine, and it's one of the many graduate training programs in medical science. So imagine SGS, or the School of Graduate Studies, as an umbrella. It encompasses all of the graduate departments at the University of Toronto. IMS is one of the largest institutes and is actually the largest institute in the Temerty Faculty of Medicine. So you have your umbrella, and all of these institutes fall under SGS. In the IMS, we have fantastic graduate faculty members. So we have about 615 faculty members that are part of IMS. About 520 of these faculty members are in 11 different clinical departments at the university. So not only are they PhDs, but they're also MDs that do medical science research. And as I previously mentioned, IMS is the largest graduate unit in the Faculty of Medicine, the Temerty Faculty of Medicine. So students also come back as alumni. So you can see here that 91 faculty are IMS alumni. So not only do they do their graduate degrees, but they love it so much that they come back and are faculty members in the department. They come back to serve in our clinical as well as our basic science departments. So we do all types of research. What's unique about the IMS? Well, we are a large institute and one of the largest graduate units in the SGS Life Sciences division. Now, we also do bench to bedside research. This is implicated in translational research, so moving from the bench to the bedside, as well as basic research with links to disease mechanisms. So we are medical science because it's all relating to disease, it's all within the medical field, but there are many different types of research that are done. Now, why do we call ourselves an institute without walls? This is because you can see our research areas all across the city of Toronto. We have students and faculty affiliated with all of the hospitals throughout the city. And if you look on our website, this logo here on the side, you can actually see the different types of research we do. So some examples are neuroscience, cancer, regenerative medicine, and so on. So you can visit our website to get more information, ims.utoronto.ca. So not only do we have great faculty and students, but we're affiliated with all the hospitals in the city. So we move as far north as Sunnybrook and as far south as CAMH, the Center for Addiction and Mental Health. Again, with researchers and students doing research from basic science to clinical science and everywhere in between. So we really are full of great research all throughout the city. What do we offer? Well, we have two main streams. We have our research, our academic stream, and this is the graduate program, MD or PhD program. This is a thesis-based graduate degree in medical science, and it leads to a Master's of Science or Doctor of Philosophy degrees. These thesis-based degrees are course light. So as I mentioned, you only need 2 credits in the master's program, which is course light in comparison to other programs, as well as many other departments. We welcome a lot of different research areas, and our faculty are geared to accept many diverse students. So again, as I mentioned, tons of different research topics, regenerative medicine, cancer, neuroscience, and everything in between. Now, our second stream is the professional stream, and this in particular is the Master of Science in Biomedical Communications. So I'm not going to focus on this today, but you can see the website if you want more information about that. And actually, this image is from someone who is in the BMC program, and they did a fantastic job. They do great medical science research. Who are our faculty? Well, our faculty are world-class researchers, and we are lucky enough to have them within the department to help our students learn. So some examples of IMS faculty members, I'd like to direct your attention to Dr. Frida Miller. She is a Canada Research Chair. Then we also have Dr. Laurence Clout, and he is a professor in surgery, but Laurie has an Order of Canada for his work. And also Dr. Kashavji, and he is a pioneer in lung transplantation, as well as the director of the lung transplant program. This is just to name a few of our fantastic faculty. We are proud to say that they are our faculty and that students are able to learn under these fabulous people. So next, moving from our faculty and our program into the bulk of what we do and our students. Among these, we're so proud to say that several clinician scientists are part of our doctoral program. In the IMS, we have about 225 PhD students, about 233 master's students, and about 47 professional master's students. So this includes the biomedical communications program. Now, these students come from a diversity of backgrounds, as well as some are clinicians that come into our program, as well as we have quite a few international MDs or clinicians coming into the program. So who are our students? As I mentioned, 14% are licensed MDs, 16% international MDs, 70% are BSc or MSc graduates that don't have any health professional training, but do have the research experience we're looking for. What's important to note is that we have a large influx of international students, and the bottom line is our students are highly motivated, academically accomplished, and they have a passion for research and exploration. So what does graduate school prepare you for? On one hand, you're training for research, and this means you conduct research and proper ethics are followed, writing manuscripts, research methodology, and obtaining presentation skills. But apart from that, other important skills you develop are learning to ask questions, solving problems, communication, critical thinking, and leadership. So the training you get is for research, but you also get training on all of these soft skills and important skills for your career through research. So it's important that you learn through research to ask the right questions, to develop these important skills for any career, whether it's research or other. So now there are three main ways in which students get into our program. One, the master's program, you need a 4-year honors Bachelor of Arts or Bachelor of Science, or an MD from a recognized university. Second way is through our PhD program. Now this is for students with a previous master's degree. So they require an MSc or equivalent with a research-based written and defended master's thesis dissertation from a recognized university. And the third way is a PhD direct entry program. Now this does not require previous master's degree, but this is for outstanding candidates. So it's a 4-year honors Bachelor of Arts or Science or an MD from a recognized university, as well as outstanding publications and research output. It's what we're looking for. So if you want to go from undergrad directly into the PhD program, that's important to note. Now, if students enter our master's program, they will have the opportunity to transfer into So for our research academic stream, entry into the IMS is based on several things. This includes academic achievements, your CV, letters of reference, a letter of intent, and a potential interview with a graduate coordinator or a member of the admissions committee. So I'm going to talk about each one of these aspects in more detail. When your application is reviewed, we look at the application as a whole. and all applications go to our admissions committee for approval. So entry into the IMS, looking at academic achievements. For the master's program, as I mentioned several times, 4-year degree or MD from a recognized university with a minimum A- average in 3 out of 4 years, including your final year. So it's important that you get that A- in your final year courses, especially because these will lead you into the research you'll be doing in your master's program. Next, letters of reference. So it's very important to choose your references wisely. You want faculty able to communicate on your skills as well as communicate about you. They should be familiar with what you've done. They should know you and your attributes. So for example, if you were a summer student or a project student with them, that's a great person to get a reference from. It's also important to contact your references ahead of time. Make sure they're given sufficient time and notice to put together a good letter for you. Just as a side note, this is written by a faculty member, not by you. So make sure you're planning ahead. All letters of reference should be from faculty, ideally with 1 research reference and other course references or whoever you think would be a great judge of your character. Next, a letter of intent. This is an opportunity for you to talk about the research you've done and what you want to do. So, what type of research would you like to do? Have you reached out to supervisors you're interested in? The committee wants to know what you'd like to do in your degree. This letter of intent also provides an opportunity to talk about other matters. So for example, if you had low grades in 1 year, what was the reasoning for that? And again, all applications are reviewed by our admissions committee, are confidential, and only shared with our committee. We will review your application as a whole. And if you want more information about the letter of intent, our website, ims.utoronto.ca, gives great information about what to write in your letter. So an interview may be required for applicants that their application was reviewed by the committee and the committee has more questions. In addition, all international students without a degree from North America will be invited for an interview. So just one frequently asked question: do I need to have a supervisor when I apply? For a master's program, you do not need to have a supervisor. It's based on the merits of your application. Now, if you're applying for the PhD program with a previous master's or direct entry, as well as international students, must have a supervisor. But for the majority of the students on this call, master's program domestic students, no supervisor is required. So it's important to start exploring your opportunities with potential supervisors. You can always start early. Early is better. So, important slide, application deadlines for our September 2021 admissions. Online applications, February 1st, as I mentioned previously, is the early acceptance deadline. So all of your documentation must be in by February 1st to be considered by the committee at an earlier time. Now, from February 1st to June 1st, there are rolling admissions. So you can apply anytime until June 1st, but we will only review complete applications. For international students, it is a little bit different deadline. So March 1st with documentation on March 15th. Now, we talked a lot about the program. I talked a lot about the faculty. I talked a little bit about the students, but what's important to note is that not only do we have great faculty and academic portions of the program, but now I'd like to discuss what else we do. IMSA is the IMS, Institute of Medical Sciences Student Association. There are many ways to get involved within the IMS, and IMSA is just one of them. IMSA promotes a sense of community within the IMS through engaging events. They've been fantastic through COVID, where they've actually been running a lot of online events, and it's gotten so much engagement because there's not much else, unfortunately, to do these days, but getting involved in your program is a great way to do it. IMSA is a fabulous way of enriching the graduate experience. Not only do we have IMSA, but another thing that IMS is very proud of is the IMS magazine. It's a department-guided, student-run publication. You can see the gorgeous images. So usually we'll get BMC, the professional stream program, to help with these illustrations. They highlight basic science and clinical research, so all types of research within the IMS, current topics of interest, and application of IMS research to national and global advancements in translational research and medicine. So that's another way you can get involved. As a photographer, a magazine editor, a writer, there are many ways to get involved with the IMS magazine. So that's all I have to say for now. Please write your questions in the chat, and Ms. Hazel Pollard is here to answer your questions. If you have any other questions after today, she is your go-to contact, so her telephone number as well as email in which you can ask your questions are on this slide. Thank you very much. Happy to take any questions. Amazing. So I'm going to read out the question to you, Ms. Pollard, and then you can answer it. If you, perfect. So how would a master's program in IMS with research in neuroscience differ from a master's program in the neuroscience program?
I think, to be truthful, Michelle, that would be a better question for you to answer.
Of course.
You're the student. Go ahead.
Amazing. Sure. So in the neuroscience program, it just depends on the researcher that you'd want to work with. So IMS has tons of faculty members. And so it really, if the faculty member that you want to work with is in the IMS, go for the IMS. In terms of the neuroscience program, I'm not positive about their course requirements, but I have a feeling they are more than the IMS. And I say that because we are a course-like department, which means that you have a lot of time to focus on your research. Thank you for that. So next question, for those who have applied for winter 2021 intake and not heard back, when can we expect to hear?
As you know, our admissions committee will be meeting on Friday, November 20th to review all applications. You should be hearing from us the following Monday, the decision made on their application, whether it was accepted, refused, or whether or not the committee is asking for more information. And the email will be coming directly from me to you.
Fantastic, thank you. So if we apply Feb 1, would our second semester marks be counted in the GPA calculation?
All marks are counted in the GPA calculation. If you apply before you have your second semester marks, the committee can either accept the application pending the final grades. Final grades can be a condition of the acceptance.
Fantastic, thank you. How many letters of reference are required? Can we apply with a Bachelor of Kinesiology as opposed to a Bachelor of Science?
Yes, an applicant can apply with a Bachelor of Kinesiology, providing the type of research you intend to do is similar to your background knowledge.
Fantastic, thank you. And then the answer for letters of reference is 3 references are required from faculty members.
Correct.
Good, thank you. So may have missed it. If I'm accepted to the master's program, do I have the option of reclassifying to a PhD after a year?
Yes, you can reapply to transfer from the master's to the PhD. After 18 to 20 months in the graduate program, the way it is done, the student apply for the transfer through an exam, an internal departmental exam. Once you are successful at that exam, then your program continues in the PhD. The good thing about the transfer, once you're successful, the master's is automatically erased and you are now a PhD student starting from the time you started the program.
Amazing, thank you. So from Lauren, very interesting. There's no neuroscience program. So actually what Lauren said and what we can discuss a little bit more is you can be a member of CPIN or CSIN as an IMS student. So CPIN is a collaborative program in neuroscience, and the IMS is fantastic for having collaborative programs. So there are programs in neuroscience, women's health, cardiovascular. There are quite a few collaborative programs. Now these require a certain amount of different courses. to be part of the collaborative program. But if your research is in one of these areas, it's a great thing to look into as part of the IMS. So the IMS has a lot of collaborative programs because we are involved in so many different research areas.
Let me follow up on what you just said, Michelle.
Yes.
Applicants applying to the graduate program at the time of application, it is noted on the online screen whether you can, if you're interested in applying to a collaborative program, you should indicate it on the application as well. Also, IMS has about 40% of our students are members of the CPIN program.
Amazing. So we have a lot of neuroscience researchers and quite a few CPIN students. That's fantastic news. If I have research experience in a different field, but apply to a stream that's somewhat unrelated to my experience, is this possible?
Yes, it is possible that you can apply to a different stream, provided the supervisor that you intend to perform the different stream with is familiar with your background and is willing to help you do the switch from the previous stream to the stream you're interested in.
Perfect, thank you. Oh, a question for me. Can you share your experience at IMS? What your experience at IMS has been like during your PhD? Yes, for sure. So my experience at the IMS has been great. It started off first, I was more kind of prone to my research site. And what I mean by that is, again, the IMS is affiliated with all the hospitals, and I'm out of St. Michael's Hospital. And so I started off small in the sense that I was, staying within my tight network at St. Mike's, and now I'm involved in the IMS as a whole, and it's been a fabulous experience. There's so much going on in the IMS. So I mentioned IMSA, which has different committees to them. So they have an academics committee, they do tons of intramural sports, they do tons of social outreach. They also have a lot of site reps. So each hospital affiliated with the IMS has 1 or 2 site reps that will bring the information from IMSA back to the students at each site. There's also the IMS magazine. There's also Raw Talk podcast, which is a huge podcast now that originated in the IMS and now has spread throughout the Temerty Faculty of Medicine. So all of these things are fantastic. There's always something to do in the IMS, and there's so many faculty members, so there's tons of different research. So I would recommend it. I also really like that it is a course-like program, especially for a PhD, and I came in with a previous master's. So with that in mind, I didn't want to do that many courses. I really wanted to focus on my research, and I have the opportunity to do that in the IMS.
I would like to add what Michelle just said and let the caller know that
Yes.
As an IMS student, you have the opportunity to sit on one of our many, many committees. IMS has a number of committees. We have the curriculum committee, the admissions committee, we have the directors committee. So as a student, yes, you can sit on one of the committees once the call is given out.
Amazing, thank you. So if we are applying to different master's program, do our referees have to upload separate letters to each program, or do they upload their letters to the system and we can choose which letter goes to which program?
If you're applying to various departments, each department requires an application. IMS requirements for our program might be different to, let's say, the Department of Immunology or Physiology. IMS requires 3 letters of reference. Other departments might require 2. Again, each department requires a different application or different application fee.
Wonderful, thank you. Does IMS have a capped number of students they can accept per season?
Unfortunately, no. As Michelle said in our presentation, IMS is an institute without walls. So because we are an institute without walls, we do not have a pigeonhole or a certain number of slots allocated for incoming students. Providing you meet our requirements, you're able to secure research supervision and funding, you can register in the graduate program.
Fantastic. So really, I would say that's a good thing. That means that we can take as many fabulous students as we get.
So true.
I'm interested in biomedical communication program. Is the academic achievement requirement still the same? I think it was stated differently. So it is different. Please check their website. We're talking about the academic stream today, not the professional stream, but their website has great indications about all of that. Anything to add, Ms. Pollard?
You're absolutely correct.
Perfect. So I'm going to give one more call for any other questions. And thank you again for having us. Is there a seminar for that program specifically? So for the IMS, the MSc 1010 course is your seminar course. So what that means is it's between September and December of your first year, and it is a seminar series where you get a lot of different research as well as skill-based workshops and seminars. After that, in your second year of the course, you will have to present a seminar. So this is a small 10-minute presentation to a group of students. And in addition to that, you will have to present at our annual scientific day, a poster or an oral presentation. And this is all part of that MSc 1010 course requirement. All right, more questions. In our letter of intent, should we be providing a general overview of our interest in the program, or must we indicate the name of a specific supervisor we want to work with? In other words, what level of detail specificity regarding our interests are you looking for?
As per the information in the letter of intent, your letter of intent should basically be letting us know what your intentions are in the graduate program, the type of research you intend to work on, and how you intend to attain the results that you're looking for. Secondly, in terms of, sorry, what was the question again, other than the letter of intent? It's
yes,
a two-part
so, no,
question.
it is the letter of intent. Just what level of detail regarding our interests are you looking for?
Something she mentioned about supervisor.
Yes, so, or must we indicate the name of a specific supervisor we want to work with?
You can definitely mention the name of a specific supervisor. However, just so you know, the Institute of Medical Science, we do not provide you with a supervisor. You, the student, the applicant, must seek out your own research supervision.
Great, thank you. So there are letter of intent guidelines for IMS on their website. Thank you so much, Lauren. You're being so helpful. I appreciate it. Is all research wet lab research? Not at all. So I'm actually in a wet lab or wet research lab, but there's clinical research. So for example, at CAMH, there's a ton of patient recruitment studies where they're looking at, clinically, there's MRIs, there's CT scans, there's tons of those things going on. And at all hospitals, we have that. So if we think about neuroscience, there's wet bench, but there's also much clinical research to be done. So spinal cord injury relating to pain. Honestly, there's every single type of research in the IMS. I kid you not. The amount of faculty members and students that we have, everything from as wet bench as you can get, as molecular as you can get, to patient screens, patient studies, looking through the databases from different hospitals, and everything in between, the translational research. Is IMS open to non-traditional students or students with a multidisciplinary background? Yes, it is. So definitely the IMS is really looking for a motivated, overall excited about research student. So if it took you a little bit of a different pathway, we are interested in that as well. We have quite a few international MDs or international clinicians that come into the program to do a master's or a PhD in our program. So all those kinds of things, we actually, a student that I'm good friends with is a mature student, and she took years off of schooling and research and came back to do her PhD. So the IMS is really all encompassing. We have many different students at all levels.
And with that said, I want to thank all of you for participating this afternoon in this recruitment period through GLSE. Thank you.
Amazing. Thank you so much, Ms. Pollard. Thank you, GLSE.
Thank you. I'm going to stop recording.